Okay, so this link here can be shared by a doctor, a healthcare professional, or employer and be sent out. Can all be white labeled, so here can be the logo, and this can all be customized. This can be the YouTube video of your company or your health clinic or the doctor's surgery, and then the LinkedIn profile as well, page. And then you just play the whichever video that you want to embed, you can play there. And then here it can all be customized, and it can be a little bit about why you want this person to do the virtual triage. So if you're an employer, it's that we care about our employees, for example. If it's a doctor or a healthcare professional, you can just write here why it's important to ensure that the symptoms can be evaluated. So simple to fill out. You will complete your full name here. And then as you go down, you enter the details. And then the email. This can work with any device and any desktop, and it takes a total of 10 minutes to do. And it's a combination of questions, which are like symptom checkers at the beginning, and then a live one-way video interview, which frees up the doctor. It's powered by AI and it's fully customizable.
Hi, welcome to Mediscreen. I'm Nurse Sarah. I will be your virtual healthcare assistant. I am going to ask you some questions about your health. For the best results, please have a thermometer ready for this interview.
If they don't have a thermometer, that's fine.
Your information will be automatically shared with a doctor. What is your temperature? A normal temperature is 36.1 Celsius or 98.6 Fahrenheit.
So Sarah is your virtual triage, right? So she will come and she'll do some checks with me and we'll just go through.
Are you having difficulty breathing?
Each of these questions that I'm being asked are linked with COVID-19 symptoms, and they're all weighted accordingly. So this could be a critical symptom, for example, and have a certain weighting.
Do you have muscle pain? Do you have a cough? Do you have a feeling of tiredness or fatigue?
And what it's doing by this is forming a picture.
Do you have a pre-existing health condition?
And evaluating my risk factor.
Do you have any of the following symptoms? Are you experiencing any of these health problems? Have you noticed any of these issues? Do you have any of the following? For how many days have you been experiencing these symptoms? Have you seen a doctor? Have you recently been in contact with another person who has been confirmed with COVID-19? Have you recently been in contact with another person who has difficulty breathing or a high temperature? Are you a healthcare worker? I'm going to check your camera.
The difference between this and most virtual, the screening process is that that's linked just for an outcome. However,
Looks good. Now I am checking your internet.
this process is linked to the healthcare professionals or the doctors, or it gives the employers a chance to see how their employees
To try.
Okay, so I will get a countdown and then I will go into the answer. And the great thing is that the doctor can actually watch back. They can watch me, they can hear my voice, they can hear my cough or anything like that if I'm looking ill as well and hearing what I'm saying. Yes, I do have a bit of a cough, but I don't think it's anything new. I've always had a little bit of a cough. And then what I can do is I can look at the number and I can say, okay, my temperature is, doctor gets to hear the breathing again when out, right? So they sent the screening out like this. This tells you that there were 100 pre-screenings and 39 have been done. Now an employer will just see this view, which is showing the risk profile of the person, but it actually does it in order of ranking. So on the first page, I can see this is critical and so on, and these are the details. What I can do now, this is all the employer will see. However, if I'm a healthcare professional, what example or other doctors, you can share your feedback on each person. And on the left hand side, you'll see all of those questions that I was asked as a patient at the beginning. It's all nicely laid out for a doctor to whiz through. And on the right hand side is all the video questions. So the doctor can very quickly evaluate each patient within normally 5 minutes. They can potentially diagnose, and what they do afterwards is they can schedule a telemedicine appointment if they wish to speak to each person just to clarify a few things, and then they can assign an action to each person, which is a COVID-19 test, tell them to self-isolate or send them to the emergency room depending on what the risk profile is, and share their profiles and say please send them all the requests for a two-way telemedicine, which can be done with another company, one of the companies that we partner with. If you are an employer, this is a fantastic tool to be able to evaluate at scale. So if you have hundreds or even thousands of employees, you can send them all this one link. They can then complete this from home, and then you can decide who to bring back. So the low risk ones can be brought back into the office, back into their jobs, and the critical ones can all be sent for COVID-19 tests, like I say, through the doctors and through their health insurance. So it's a very quick way of assessing. What's important is that we avoid the second spike. So continuous pre-screening is critical to ensure that everybody is safeguarded. So that's Mediscreen. It's a virtual triage and it's available for many screenings: heart, diabetes, COVID-19, etc. And really it works hand in hand to give the health professionals the tools they need and the employers the tools that they need at scale to be able to reopen the countries and start reopening their businesses back safely. Thank you.